The following presentation is for informational purposes only and is not intended to diagnose, treat, or cure your condition, or to be a substitute for advice from your physician or other healthcare professional. Welcome to Tools for Healing and Well-being. I'm your host, Elaine Jagielski. In this episode, we'll explore a modality I've termed Yovascia. It combines breathing practices, vagus nerve stimulation, fascial exercises, and even some lymph movements. The lymphatic system is part of the immune system. It keeps your body fluid levels in balance and defends the body against infections. Lymphatic vessels, tissues, organs, and glands work together to drain a watery fluid called lymph from throughout the body. Lymph collects fluids from your tissues and returns them to your blood. It carries nutrients and proteins to your cells and tissues. It also collects any harmful substances found in your cells and tissues. The combination of the various movements potentially puts the body into a state of rest, rejuvenation, and healing. It stimulates the parasympathetic nervous system, the rest and digest one, which signals to the sympathetic nervous system, the stress one, that you are safe and it is okay to relax. For a full list of benefits of this practice, I would suggest viewing Breathing into Wholeness, Vagal Tone, and Fascial Fun. Welcome to this episode. So would you mind introducing yourself?
Hi, I'm Marcia McEwen. I'm a retired nurse, and I've always been interested in healing of any modalities, sound and healing, therapeutic touch. And so this Yovascia has me just fascinated. I'm anxious to learn more about it.
Wonderful, wonderful. And you're currently in Lethbridge, right?
Correct.
Okay, wonderful. All right, excellent. So I'm just going to talk you through kind of the sequence as we go through it. And the whole concept of Yovascia is something that I kind of put together to try to assist to get the body into a sort of regenerative, rejuvenating mode. Definitely moving more into that parasympathetic nervous system rather than the sympathetic, which is the stress, the fight, flight, and getting into the rest, digest modality. So we're just going to begin with some breath work. So this will be a mini version of what a class would look like. But even if a person wants to do any one of these things or combo up some of the pieces, then wonderful. Do it in that way. That'll work perfectly well. And you've had a little bit of experience with this. So you're not brand new to this. You do have some experience, which is great. All right. And because you're a believer, you've seen the benefits, yes?
Okay. I have.
And maybe we'll talk about that a little bit toward the end then.
Okay.
Excellent. So we're just, like I said, we're going to start with some breath work as best as you can. And today we're going to focus on movements that a person could be doing just even watching this seated, maybe some standing. And so you want to, as best as possible, align your ear over your shoulder, over your hip. And if a person's not 100% sure as far as, well, what does that actually look like, just do the best that you can, right? So you just want to feel very tall, very lengthened, so that your lungs have lots of room to expand into. And so we're just going to begin with about a 4-count breath in and a 4-count breath out. So it's going to be something like, so get ready for an inhalation. So it's a breathe in, 2, 3, 4, and out, 2, 3, 4, and in, 2, 3, 4, and out, 2, 3, 4, and in. Now continue with that rhythm on your own. And exactly, eyes can be open, they can be closed. Closing allows for about 85% of that external stimuli to be removed.
but whatever a person might be comfortable with. And so continue with that 4 in, 4 out. If that feels too fast, slow it down a little bit. If it feels a little bit too slow, then speed it up slightly. So making sure that it's a comfortable, rhythmic breath. Wonderful. Then from there, if it feels okay, wherever you are in the rhythm of it, after your next inhalation, you are then going to hold for 4 counts. So in your pattern, it will be an inhalation for 4, holding the breath for 4, exhaling for 4, and then inhaling for 4. So we're making it's a kind of a triangle or a pyramid breath at this point in time. And it's great, so just keep that rhythm going. And so it's great to hold your breath at times. It actually helps with the cardiovascular system. There's lots of benefits, unless, of course, it creates any kind of discomfort within the body, within the breathing pattern. Then feel free to go with the inhalations and the exhalations. If that feels okay, then feel free to add on again. So it'll be a 4 count inhalation, 4 count hold, 4 count exhalation, 4 count hold. So now we're doing a box breath. So we've got a 4 in, 4 hold, 4 exhale, 4 hold. And again, if that extra hold creates any kind of discomfort, then don't do that. Either stick with the pyramid breath or just the inhalation and the exhalation. So just do whatever works best. One more add-on. And again, this is an option. If you like, you can begin whenever you're doing your inhalation, begin to lift your chin or move the neck into a hyperextension, and then hold the chin lifted on the hold. Then when you exhale, you're going to drop your chin to your chest and then hold during the breath hold. And then again, when you inhale, you're going to lift the chin, hold, and when you exhale, then you will drop the chin and hold. And so just try that a few times. And again, work with whatever works for your neck. If there's any major discomfort or even minor discomfort, then either keep the flexion and extension, the lifting and the lowering of the chin minimized, or cut it out completely. Wonderful. All right. Just let that all go. Just let that all go. All right. And then just bring your focus, your awareness back. Wonderful. Okay. So even after the breath, how does that feel?
Feels good.
Excellent.
It's relaxing.
Nice. Okay. Good, good, good. Well done. Your body's responding well. So that's excellent. We're going to move into a little bit of just some lymphatic drainage movements. Right, our lymph nodes are one of the areas where we have lymph fluid in those areas, and there's toxins that can build up. And so one of the ways to help those toxins move through and be eliminated is to do certain kinds of movements. And so one of the types of movements to help with the ones around the ears or in this section is just to take your fingers and just kind of grab on, and then just move your ears around. So twist and turn and circle, and it can be in different directions with each ear, and just moving them around, just kind
the
of.
whole
It can
ear
be circular.
or just the lobes?
Right into
Just
the right into the
canal.
the depression in the lobes. So.
Okay.
So in the cartilage part, just get right in there and move it all around. Now you don't want to feel any pain, but you will feel movement. You'll be moving those ears around a little bit. Yeah, pull them back, pull them down, kind of pull them out a little bit. up and down. All of that, yeah, great. And then maybe a few movements where one finger is just in front of the ear, and then just a little bit of tracing, maybe behind, in front, just a little bit of pressure, just a little bit of pressure as you move down, assisting with any drainage that might occur. Great for the eustachian tubes, so as well. Good, good, good. So just front and back, just kind of moving things around. Excellent. Okay, great. All right, just let that go. Now, to get to some of the lymph nodes in the neck and sort of the chest area, we're just going to do shoulder shrugs. So you're just going to do quick up and down shrugging. Okay, so you're just doing those shoulder shrugs. Good. Yep. So just up and down, up and down. Good. And then just let that go. And then to get to the ones in the armpits, moving into sort of a chicken arm position or as if you had wings. And then you're just going to flap your wings. Okay? I know some of these feels like kind of silly and
kind
goofy.
of fun.
Yeah, but you're just sort of pumping, right?
Okay.
You're just creating pumps for the movement of that fluid. Good. Yeah, yeah. Now, to get to some of the abdominal region, you're going to do compressions. So as best as you can, you're going to engage what's called your transverse abdominis muscle, and you're just going to pull your navel back towards your spine and then let it go, right? So you're just pulling in, pulling out, in and out, in and out. Excellent. Yeah, and if you're not used to doing this, sometimes it might be difficult for a person to go, what? How do I do that? Just the best that you can. And maybe initially the person could even use their hands a little bit to go, okay, how do I make this happen? Excellent. Good, good, good. And then, so now we're going to do, and often this works quite well if you're seated, like if you're actually sitting on the ground, but we're on a chair. So we're going to do the best that we can. Your feet come together, kind of like a butterfly position. And we're just going to flap. We're just going to flap. Okay? You're just going to flap the knees in and out, in and out, in and out, just as best you can. Yep. Yeah, and rearrange on the chair as much as you need to. Excellent. All right, let that go. And then to get to the ones in the lower legs and the calf area, we are going to stand. And a person can hang on to something if they need to, or we can use these if required. So you might have it there just in case. And then come up on your toes and down. Because we're not really worrying about working the calf muscles. We're just working on creating a pump. So it's just up on the toes and down, up on the toes and down. Yeah, just a few of those. Maybe one more time. Excellent. All right. And we'll go back to a seated position. Wonderful. Now, we'll move into a few vagus nerve stimulation exercises as part of this. And again, make sure you're comfortable in your seated position as best you can be. And so we're going to begin with a seated half salamander. And so what this one looks like is, I'll talk you through the different sort of parts of it. And so you're going to begin by taking your eyes, so I'll talk you through because your eyes might not be looking at me and depending on the direction we're in. So you're going to take your eyes over to the right. So your eyeballs are going to go as far right. Your head's not going to move yet, but your eyeballs are going to go as far right as you can. And then you're going to start to rotate and tuck your chin into your right shoulder. Right, good. And then you're going to try to bring that right shoulder as close to your right hip as possible. Okay. Yeah, so then that left rib cage is going to be sticking out a little bit. And we're just going to hold. So usually it's about a 30-second hold or so. So it's about 30 seconds or so. Good, yeah, looks good. And then reset, come back to center, just reset that. Good, you got it. All right, now we're gonna do the other side. So this time, you're going to look to the left. So you're going to take, but not your head, just your eyeballs are gonna go over to the left. Then you're gonna begin to take that chin, kind of aiming it towards that left shoulder. And then let the neck bend a little bit. Then try to bring that shoulder toward the hip. So the head's rotated, eyes are well over to the left. Yep. And if this happens to create, by having those eyes, that we're just going to hold, if having those eyes so far over creates any kind of discomfort in any way with the ocular muscles, with any sort of dizziness or nausea or anything like that, then perhaps closing the eyes may be useful to alleviate some of that, hopefully. Wonderful, wonderful. And then just reset back to center. Back to center. Good. Excellent, excellent. Okay, we're going to do one more for the vagus nerve. And so we're going to clasp your hands, lace them, if it feels okay for the shoulders. If not, then do it without that part. And just your thumbs are kind of along the base of the skull. Again, you're going to take the eyeballs over to the right. The head doesn't move, but the eyeballs are going to go as far to the right as they can. And until you feel the inclination to sigh, to swallow, or to yawn. And then when that occurs, take your eyes back to center and then over to the left until the same inclination occurs. Right? So you've got your eyeballs as far as you can to one side until you feel the urge to swallow, to sigh, to yawn. And then if that doesn't seem to be happening after a while, then just shift over the eyeballs to the other side. And so sometimes with that, it just takes a bit of practice. So then you would take your eyeballs over to the left as far as they would go. And once again, until you felt the inclination to breathe, to sigh, to swallow. And as before, if that doesn't seem to be happening, it's okay. Just take your eyes to center. It's just an indication of a few different things that maybe that vagal nerve needs a little bit more toning. And usually with a little bit of practice, then you'll find that that inclination starts to happen more quickly. All right, perfect, good. And just relax your arms, relax your arms. Good, excellent. How's that feeling so far?
Feels good.
Okay, good. So now we're going to get into just a little bit. So there's a number of ways to work with the fascial tissue. And one of those ways is any kind of a ball. So feel free to grab your ball if you like. And then just using rolling or pressure. Same thing can be done with a roller or a pool noodle. Pool noodle doesn't have quite as much tension, but still it can be utilized. Even a rolled up towel or anything along those lines. A person can get creative to apply pressure. So there's a number of different ways to work with that fascial tissue. I'll talk a little bit more about that in a moment. So seeing as we're in a seated position, we're actually going to work with just a little bit across the hip. And so you might lean over and just place that ball closer to the hip joint. Now, of course, feel through. If there's any discomfort, then maybe move that ball or avoid that side if there's something going on specifically with the joint. And then you're going to move around on the chair a little bit and feel so you're just rolling across that hip joint kind of into the top of the hamstring, into the glute area, and into a part of the superior fascial back line. Good, yeah, using kind of just scooching around in that chair a little bit.
Yeah,
And then,
it's slippery.
Is there a spot that you can feel there? Mm-hmm. Okay, hold it there. We're just gonna hold it there.
Okay.
Now, if a person finds a spot where it's like, ooh, yeah, I can really feel that. But if it's really intense, then it's probably advantageous to start a little bit further away from the nexus of it, the center of where it's really uncomfortable, and then gradually move in more closely as the tension decreases from a point further away.
I'd call it a good hurt.
Yeah, yes,
Yeah.
I like that, a
Yeah.
good hurt, yes,
Yeah.
exactly. Good, and then just take that away.
Okay.
Now, and of course you would do the other side, but we're kind of doing an abbreviated version.
Okay.
So then you could take that ball, and we're going to use the back of the chair, and so you might sit away a little bit so you can provide a little bit of pressure. And then just wherever is available, so somewhere in the mid-back, and just pick one side for now, or you might kind of roll across both sides. It might be a limited area. You might kind of go up and down a bit, side to side. And oh, I love the face. That means there's stuff. There's
Yeah,
stuff
there's
happening.
stuff going
Okay.
on.
And so just moving it. And a person could do this standing up against a wall, lying down, of course. That'll work as well. That'll work too. Good, 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 good. And then again, is there a spot? Did you find, like, there might be a number. Is there one that is like, and then just hold,
Yeah.
just apply a little bit of pressure. Good, and just hold it. And as for the type of ball, I mean, it can be anything. It can be a golf ball. It can be a lacrosse ball. It can be a tennis ball. It can be whatever kind of ball has some level of pressure. So whatever's available for a person, or anything that's kind of rounded, will work as well. Okay, and then just release that. Wonderful.
Feels good.
Let's set those off to the side. We're going to stand and move into some standing fascial movements. And so to begin with, and you can do this bare feet, you can do this with socks on, you can even do this with shoes potentially. And so one of the movements we're going to begin with is we're going to step forward. This forward leg is going to stay straight, all right? And then very slowly, you're going to allow your back, you're going to bend at the hips, and your spine gets to flex. This knee stays straight, though.
Both knees straight?
No, the front knee.
Just the front
The back knee can be fairly straight, but it can bend a bit. As long as that front knee stays straight, then we're good. Right? Okay, great. And then slowly come up. Now I might have to step forward just slightly on my mat. Then you're going to step back with that leg. So step back, good. Again, back leg stays straight. So your right leg is going to stay straight. And now we're going to open up. We're going to hyperextend. And if it feels okay for the shoulders and arms, we're going to lift. If that hyperextension doesn't feel good, then just go to extension, where you feel like you're aligned. Okay, that ear over shoulder over hip. But if there's any hyperextension available and it feels all right, then give that a go. So then you're going to come forward again. If it feels okay with the hands, and if there's any blood pressure issues, only come down as far as you can, right? And then step back. Now you might do an inhalation here, and then step forward and exhale. Good. And eventually, a person could even do things like they add a little bit of speed and a little bit of velocity, okay, where they're kind of almost recoiling a little bit. And a person can always hang on to a chair, hang on to this, anything that might be available if the balance is off, if there's a bit of wobble. But you got it. Leg is straight, back is flexing, and then hyperextending. Good. And then just recenter.
It's good for balance.
Yeah, you get to challenge the
Yeah.
balance as well. But like I said, a person can always hang on to something also, right? Wonderful. Good. So let's just do a couple on the other side. We probably won't match it as far as numbers, but just to kind of do a few on the other side. So step forward again. Whoopsie, knee is straight. And again, if the arms feel okay coming down, come down to whatever extent the person can, and then stepping back and opening up. Nice. And stepping forward. Good. Continue to do that at your own rate. Keep that moving leg straight. Yep, so when you step back, it's straight, and when you step forward, that knee is straight. And so when you're forward like that, that is working the back superficial fascial line, which starts at your big toe, works its way up the back of your body, and ends at your forehead. And when you are lifting up, that's working the front superficial fascial line, which again starts at the toe, ends at the head. Excellent. Good. Okay, let's reset. Okay. Let's go wide. We're going to work some lateral fascial lines. We're not going to get to all the lines. There's 12 different ones, but we're going to get to a few of them. And so with this one, you're going to just drop your hip. Drop one hip, because we're going to do both sides, so it doesn't matter. Just drop one hip. Good. And push this other hip out. Then you're going to take the other leg, and you're just going to cross it. You're just going to cross it and then push the hip out. Good. And then feel free to grab that roller and stick it in front of you if you
Yeah,
like.
good idea.
Yeah. Good. And then step back out, push out the hip. And if it feels okay, so you can always hang on with one arm if you like. If it feels okay, either bring hand to the shoulder or the arm can reach. Right? Starting to get into some of those arm lines. And then come across, open up. Now open up this side. But again, like if a person's hanging on, then you adjust the arms accordingly, right?
Okay.
Like hang on, maybe only one arm does the movement. That's okay. That's okay. So we're working some of those lateral fascial lines. So coming across, good, just as best you can, and then back over. Excellent. All right, and then just reset. We'll do a few on the other side. So let's let that hip come out, the other hip. This time, this side drops. Good.
I feel like I'm doing
no,
the same side.
I lied. It's this
Yeah,
side. This
yeah.
side drops. Good. You knew
Okay.
what was happening. Okay. Now
Okay.
we're going to cross over, and now this hip
way.
is going to push out.
Okay, now it'll go out. Okay.
Good. And then you can step out and let the hip drop, and then we start adding some movement. And so with these fascial lines, and then at your own rate, just continuing to breathe, a person might have tension, it might be a headache, let's say. Let's say they have a headache in their forehead. And as was mentioned with that back superficial fascial line, that starts at the big toe, then, okay, you just reset, and then we'll just have a seat.
Okay.
And so with that, what can happen is that there can be tension anywhere along the body that's creating the tension, even though it might be felt here through this area. It might be due to something else, or anything. If there's discomfort in a certain area along those lines, then it could be due to a totally different area, as far as that's concerned. So that's a little bit of a practice. It's just little bits and pieces. And how is that for you? And how has your experience, not only in this session, but in others, how has that been?
It's amazing how these exercises feel simple, but how deeply they work. Yeah, like after our classes the next day, and probably for 2 or 3 days, I feel the areas that we've been working. So it's wonderful.
Excellent, excellent.
Yeah.
And have you noticed any changes, especially from when you first began?
I've got very arthritic hands. I'm 75. And when I started, I could barely put my hands together. And now I'm very pleased with the flexibility in my hands.
Excellent. All right. Well, thank you so much, Marcia, for being willing to be part of this episode. I appreciate you being here. And so thank you for joining me.
Thank you for the opportunity.
When you are first starting to combine these movements, you can either follow along with the demonstration or just choose one exercise from each category of breath work, vagal toning, and fascial exercises, with the possibility of adding a lymph drainage movement as well. The whole practice can be done without any equipment in the comfort of your own home. It isn't an all or nothing approach that is required to potentially experience benefits. Do your best to begin with one or a few movements that seem to stand out or seem doable for you. Your body is going to enjoy your focus on assisting it in feeling better.